Thank you so much, Aras and Ramina, for your wonderful presentation. It was so illuminating, so helpful, and I think so important to feature at the CH conference. I encourage everyone who is in here joining us. If you feel free to use the live chat, it would be really great if you also use the Q&A function, and we can direct some questions to Aras and Ramina in the remaining time that we have together. And as we wait for questions to come in, perhaps I can pose one to the two of you. The first one that I have is, how can BIPOC be better brought into the fold when it comes to those decision-making powers that you both talked about?
Well, I think maybe I'll start and pass it to Ramina. So I think one of the things that we've noticed is that in many communities, folks have not really mapped out the different stakeholders who are at the table and haven't really clearly articulated how decisions are made beyond just maybe a set of policies that are on paper, thinking about in practice. What would a change in a prioritization policy or a decision about resource allocation or a decision about a new program or project look like? How would that be actualized in your community? And when you start to actually get into the operational side, it becomes really clear that even though sometimes there might be advisory boards or committees or a certain set of diverse stakeholders at the table, in a lot of the communities that we work with, ultimately decisions are made not in any kind of shady backroom way, but just in the relational way that life plays out in practice, in ways that leave some people on the outside. And so just starting to be in conversation around, in practice, how are decisions made in our community? Let's run through a few scenarios, is a really good first step that I think helps illustrate where diverse sets of stakeholders are at the table and where they aren't. And then I think once folks have established that baseline or understanding, what we're seeing is that often it is specific communities or groups, races or ethnicities, service providers, agencies who are not at the table. So one example that I know that I think about often is a community that has a large Haitian and sort of islander ethnic demographic group who is often not at the table of the core service providers who in the States are funded by a particular city or maybe by the state or province. And so thinking about that group as often being on the outside and working to build bridges to ensure that when core decisions are made about where do we do street outreach or what new program is needed in our community, those folks have an equal seat at the table. So maybe a little bit less of a sort of general operating rule, but thinking about really in your specific jurisdiction, who are the groups who are often experiencing homelessness or housing instability, and how do we make sure the organizations serving them, which are often representationally a lot more similar to those groups, have a seat at the table. I don't know, Ramina, what would you add there?
I love that answer. I think the only thing I would really add is that I think that's 100% right. And I will say that building those bridges take time because trust needs to be built, right, between different groups, especially if we're talking about groups or organizations that have been, left out of these conversations and decision-making generally. So I do want to encourage doing this and the understanding, right, that like equity will take a little bit of time. So it might be a little messy at first, but it's worth doing.
Well, thank you both for your answers. And we have a great question from the audience from Stephanie. How do you balance the need for BIPOC data with the impact of asking this information from homeless clients? Asking such personal and potentially stigmatizing information can negatively impact people experiencing homelessness, yet that data is needed for us to better understand BIPOC needs. How did you minimize the impact of collecting this data?
Sure, I'm happy to start. So we think that the thing that we have learned and that I think bears out in the literature is that having folks self-identify is really the key to both ensuring that the process of data collection doesn't feel burdensome or stigmatizing, but also to get us better data quality. So at least in the States, often the data is at its worst when it's case managers or outreach staff asking individual people about how they identify, or even worse, not asking and just looking at somebody and making a set of assumptions. And so I know that in the field, it can be really challenging. There are contexts in which we don't really have the luxury of sitting down, answering somebody's questions, giving them a lot of time and space to share their story and their demographic or personal information. But I think where possible, trying to create spaces where people are self-representing, right? So even if it's in conjunction with somebody who is a homeless response staff person filling something out, giving them the agency to self-identify feels really powerful. And some of what that has brought up for us, as well as feedback about people saying none of these categories match how I identify. And being able to, in that moment, use a other field or box, or to somehow acknowledge that these are imperfect categories and that people are complex, and that that they may self-identify as, to go back to the example from earlier, Haitian American, and that's the box they would love to seek out. It's not on the form. I can write that down, and then the system on the back end can code that. We've seen that is a really strong best practice, making sure that we're honoring self-identification from the client or individual.
Romina, did you want to add anything?
Yeah, I think the one thing I would add, right, is there's such an importance to self-identification. And with that, I think if we're worried about things like stigmatization, for good reason, right, that again takes a little bit of trust building between folks in the system. And you can always just talk to folks about how they would like to be asked, or like how, folks in their communities would like to be asked certain things, and kind of build that kind of trust and build a process that feels better for folks too. So it's not just an issue of collecting data just right, but it's how you're actually doing this so that can make folks feel more comfortable and have a system that's actually more accountable to them in terms of how safe they feel giving information like that.
And I think related to that safety, Romina, such a good point. What I would just add is making it really clear that somebody's demographic information, their race, their ethnicity, is not going to impact their eligibility or experience of services is really crucial. And so hopefully in most of our communities, that's already taken as a given. But I have found that especially for some more sensitive demographic information, whether it's somebody's race or ethnicity, or maybe it's somebody's sexual orientation, these are data that are valuable from a zoomed out understanding who experiences homelessness and how to offer more responsive and comprehensive services. But at the individual level, sometimes people may not know, why am I being asked this question? Is it going to make me eligible or ineligible? Is it going to change something about my experience or likelihood of receiving help? And so that proactive messaging, and sometimes it's as simple as having it at the top of an intake form. This section is optional and will not impact your services, but is to make sure we're able to do better planning and responsiveness, or what have you. I think people are often really receptive to that.
Thank you both. So we have another question here from Michael. How can we use these platforms to encourage municipal, provincial, and federal policies, managerial teams, technocratic strategies, and bureaucracies evolve with the realities of people experiencing homelessness and the working poor laborers within the helping professions? Often workplaces are perceived by some to perpetuate and/or may be complicit in structural oppression. Is it possible to influence departments and divisions to adapt their approaches? It's a really simple question.
Do you want me to? I can take a stab at this.
Yeah,
that would work. Yeah, I think. Okay, sorry. Let me go over this again. So these platforms, as in, or ask maybe if you have a faster answer,
sure.
But do you mean like these kinds of conferences, or do you mean like the indicators framework? Is that like should I not ask that question?
No, I think maybe let's think about it through the lens of the indicators framework, because I actually think it's been an instructive experience. So we don't work at a bureaucratic agency, right? We work at a non-for-profit, but even for us, the process of committing to these indicators has been somewhat transformational in terms of our internal practices and policies, because I think that it is hard for a municipality to say we want to have an equitable homeless response system that involves equitable decision making and lived experience and system outcomes, and to then not have to introspect and think about who has decision making power in the municipality, or what is the lived experience feedback of Black, Indigenous, sort of other groups within that workplace, right? What kind of feedback are they seeing? So I know for us, our team, we were all very keen to say, if we want to be able to authentically or meaningfully show up in conversation with communities about their work and their systems, not to say we have to be perfect, we are far from it, but that we have to be able to meaningfully engage with those same ideas inwardly, and to be honest about our work and our flaws and the areas that we are hoping to grow and some of the places where we have fallen down. And so creating that space and normalizing the idea that improvement starts with acknowledging the problem where it exists. We think that that is a great place to start, and data can be a really valuable tool so that we can move into a space of shared agreement about some of the areas for improvement. And so that's been really illustrative for me of the value of making something concrete, even if, like I say, these indicators are somewhat imperfect. They give a space to have a conversation about, well, specifically when we talk about equity and system decision making, we have room to grow. Or actually, when you look at system outcomes separated out by race or ethnicity or different groups, here's what I'm seeing. And creating that space for people has been really powerful. I don't know, Romina, what else you'd add. I think we are early days in terms of seeing how that changes the broader, outside of the homeless response, you know, in a city or a municipality, what happens when folks start to do this. My hunch is that because these systems are all intertwined and interconnected, a conversation that starts about homelessness response will very quickly start to talk about folks aging out of foster care and the criminal legal system and health systems and who's getting discharged out of hospitals and so on. And so I think there's an opportunity here for us to maybe think a little bigger, but starting within the locus of control that we have.
Yeah, I think that's right. And I would say early indicators actually do show a little bit of that in certain communities, that it tends to start getting involved, like other systems start getting involved in this kind of conversation. You can see it in certain other spaces like prison abolition and conversations like that too, how getting more comfortable with being uncomfortable with the discussion of racial equity tends to kind of be a little bit contagious, I think, in a really good way in having these kinds of conversations. So I do think that like the improvement mindset of having these things measurable is awesome because it's a place to start, for us, as you were saying, right, and to improve on. And it also gets folks into that, just the mindset of like, we can do this kind of work, you know, and it won't be perfect, but we can actually start to have these conversations in real meaningful ways instead of being so afraid to approach them, which we used to see a lot of and still do in some places.
Great. The next question we have is from Kira. So glad to be able to learn from you today. Thank you. My question is about measures for the indicators framework. Has Community Solutions developed any yet, or is it mostly the work of local communities to do together, or both? Forgive me if I missed this already. My internet went down for a bit.
It's a great question. It's a little bit of both. So Romina's been leading a team that has been working to come up with sort of baseline assessments across all 4 of these indicators. And what I'll say is, I think that the level of sophistication or maturity of those measures varies across the 4. But Romina, not to put you on the spot, would you share a little bit about what some of those measures look like? And I think it's maybe a little bit easier on the outcomes and quality data side, but I think it's maybe a little bit more honestly groundbreaking on the qualitative metrics around system decision making and lived experience. So maybe we can just give folks even a flavor of a couple of the types of questions or how we're thinking about it.
Yeah, I can especially talk about the first two indicators, I think, the qualitative ones. And this is, for us, I think an area of exploration. Community solutions is very strong on like the quantitative, but for system decision making power or like satisfaction of folks with lived experience, it's a little bit of an area where it's new for us. I think it's safe to say that. So one of the things we're thinking about in terms of a baseline assessment for communities is having them essentially take with us this assessment to determine where they are in this process and where they can improve. For the system decision making indicator, what we're actually just asking folks is to do a little bit of what Aras had mentioned before, which is map your system decision making areas, right? So who's actually at the table, and do you have folks from all levels of your homelessness system involved in this? So that would include people with lived experience of homelessness, frontline staff, and others throughout. And also to talk about and to determine whether or not and how many of those folks really are people of color, right? And then after that, kind of go into the experiences of folks and how to improve this kind of decision making over time. For the lived experience pieces, we're essentially asking if folks, have ways to collect essentially consumer satisfaction data from folks experiencing homelessness in a way that is, hopefully almost in real time. We're kind of asking folks to be able to do this and kind of compare the experiences of everybody and the experiences of people of color who are experiencing homelessness in the system, and to kind of start to figure out ways to improve and balance those experiences. Aras, is that helpful?
For sure. I think the other thing, Romina, that we should name here is that on the decision-making power equity piece, we've sort of thought about funding, policies and procedures, and strategic planning as three big types of activities that our municipalities or our response systems are engaged in. And that for each of those, we should be thinking about how do big funding decisions get made? How do policy and procedure changes get enacted? How do strategic planning decisions, which definitely impact both of those earlier things around funding and prioritization, who's at the table for those? And that's been really valuable as well, the specificity of it. So as Romina said, it's still early days, but I think we can definitely keep folks in the loop around our learning there. The quantitative side is a little bit easier. What we've done there is really tried to focus on a model that leverages learning from education and other sectors to establish a set of standards, minimum standards for system-wide performance. So what that might look like is a community saying, in our municipality or community, we think that no one should experience homelessness for more than 90 days. And then you use that minimum standard, and maybe it's 90, maybe it's 180, whatever it is. And then you look at intersectional analysis, by which I mean you look at race and ethnicity, but you also look at age, gender identity, you look at sexual orientation data if you've got it available, and you see which groups are at or below that threshold or are doing worse relative to their peers in terms of system outcomes. So that it's not that they are doing worse, it's that the system is doing worse in serving them. And that's been really powerful because I think when you start to look at data across groups in a way that's not about judgment about those groups, obviously, but it's about thinking about the places where our systems are not serving people to the degree to which we need to be. That's been a really powerful lens for starting to do that targeted universalism work that Romina was describing in the presentation. And so we've seen communities sort of do that mapping exercise of looking at, okay, for us in terms of length of time or in terms of returns to homelessness, which groups really stand out as being not meeting our minimum standards that we want to have as a system or as a community. And often that maps to groups where there aren't services tailored to meeting the needs of that group. And so it creates a really great opportunity for generative work around new program development or new targeted efforts to try and support specific underserved communities or groups. We've seen a lot of early success in that area.
So I see one last question in the chat from Susie. Collecting race-based data may be a challenge in some areas. I think there's an option to add races or ethnicities in HIFIS, but there may be reluctance of service providers to inquire about a client's race, ethnicity, or ethnicity. Any advice?
So I think the advice for me is to think about the context where the data collection is happening. So what setting are we in? And it's going to be different depending on your community. But to me, again, the North Star is having folks self-identify and making it feel as much as possible as somebody is self-disclosing that information, they're having agency around it, rather than having somebody ask them those questions, or maybe worse still, having somebody make assumptions about how they identify. And so using that general principle, I think, helps me think about, okay, maybe this is a context in which somebody's arriving at a homeless shelter, it's at night, there's a queue or a lineup, there's not a lot of time. So maybe actually what I'm doing is coming back to those individuals the morning after and giving them an opportunity to provide that additional information. Obviously, we do all of this already, you know, whether it's HIFIS or some other data system, folks are engaged in data collection. And so I think that this race or ethnicity, the sensitive demographic information, just creates maybe an extra step for us to think about designing a process around to make sure that there is some psychological safety or a context in which people can comfortably self-determine and self-identify. And I know it's challenging, right? Because often the context that we're in, and when I use that word context, I mean literally, I may be doing street outreach in the evening as folks are winding down their day. And it may not feel like it's a great time for me to say, oh, by the way, can you fill out this form or questionnaire or survey? I know that that is true. I certainly, I'm not going to pretend that this is easy work. But I think if we want to have meaningful data, we have to think about those contexts and try and carve out spaces where people can self-identify. And when I say self-identify, I don't mean we should just give people a blank box that says, what is your race or ethnicity? I mean, sometimes that might be the way to go, but often that may end up creating a bunch of extra headache as well. But at the very least, if we, let's say that we have a form with set categories, you know, as we do with a census or sort of federal data, okay, let's use those categories, but create the opportunity for somebody to fill it out themselves, rather than having it be, you know, sort of a more a data process where they don't have agency or authorship.
So I lied to you. There is one more question, and this one's from Kira, and it's really just thanking you for answering her earlier question, as well as whether you folks have any background documents or resources from Community Solutions regarding the work you're doing in developing baseline assessments or other workshops, webinars that folks can access.
Absolutely. So we definitely have a few materials on the website that we can link after and share with folks. The other thing that we can do is commit to making sure that you know, the sort of the Canadian Alliance and Built for Zero Canada stay in the loop as we are establishing more of those assessments, a lot of which are currently in draft form. But I imagine over the next few months, we'll start to refine and sharpen those and then publish them more officially. And we'll make sure that they're all accessible to be sort of adapted or adopted or learned from for the Canadian context. And likewise, we're really keen to continue to learn from the work that all of you are doing. We know that particularly when it comes to partnership and meaningful collaboration with the Indigenous community, we have a lot to learn from all of you and the Canadian context. And so lots of good work still to be done, but really hoping that we can continue to learn together and alongside each other.
Well, thank you both so much for sharing your time with us today and answering all of these great questions. I think your website, is it communitysolutions.org or is it .com for folks?
Actually, community.solutions.
burn on
very
me. Thank you for
No,
thank
no.
you for that. You know what? I've been on your website so many times as well. You think that I would remember. So if folks want to learn more about the research and everything that's going on, all the incredible achievements that the communities you work with are making, there's so much exciting things happening, and that is why CAH is, you know, we have Built for Zero Canada. Instead of reinventing the wheel, we've definitely done a lot of learning from you folks as incredible partners. So really, thank you so much. And thank you to our audience for joining us today, for your wonderful questions, and for participating. Just a friendly reminder that you can complete a session evaluation, which is located under the video player on your screen beside the discussion tab. That information really helps us build better conferences in the future. And I'm so excited for our upcoming keynote at 12:15 Eastern, or sorry, 12:30 Eastern with Tanya Talaga. So thank you both again for making time today.
Thanks, everyone.
Thank you.